Meeting of the Finance Committee to order. Excuse me. Would you please call the roll?
Rahman,
Present.
Long,
Here.
Powell.
Here.
Cavell is absent with notice. Smith Charles,
Present.
Wiper, Hoffman,
Present.
we have quorum.
Thank
Oh,
you.
Markham.
I'm here.
There we go. One more.
I'm here. How are you? Okay. Next up, we have the Pledge of Allegiance. Would you please all rise if you can and join me?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next, we have approval of the previous minutes. I'll take a motion. Commissioner Hoffman, supported by Commissioner Smith Charles. Any changes or additions or deletions? Seeing none, let's prompt the vote, please.
Six yeas, no nays.
Okay. Next, we have approval of today's agenda. Moved by Commissioner Rahman, supported by Commissioner Powell. Any additions, deletions, changes? Seeing none, let's prompt the vote.
Hold on, it's
Okay, not just me,
Slow
it's
here.
no, okay. No one has those yet?
not yet, hold
Okay.
on.
I was going to refresh.
There you go. See Papa John.
You have 6 yeas, 0 nays.
Okay, motion carries. Next, we have our first public comment, open to anybody from the public who wishes to address us at this time. Please come to the end of the table and you have 3 minutes. This is set up.
Good morning. My name is Larry Gray. I'm supervisor for Commerce Township. I was here yesterday during the public service meeting when the draft went through for the fire dispatch. I just come in with concerns from Commerce Township as well as plenty of other CVTs that Oakland County Dispatch uses with the cost increases that we've had. I'm not sure if you folks have actually looked at what the actual dollar amounts are that this is increasing or just the percentages. But just for Commerce Township alone, the increase is going to be almost $55,000, which we did not budget for this year because we did not expect this large of an increase. We understand we have more calls, 100% behind paying for the additional costs we have. Where I have issues with is the indirect cost. Just with Commerce alone, we're going to be experiencing about $8,700 just in direct costs, which doesn't sound like a lot. But the concern here is, as we move forward with this, with our public safety, we also have Oakland County Sheriff Office out in Commerce Township. If we have these same sort of increases, our contract for our Oakland County Sheriff is about 30 times larger. So this is going to be an additional $300,000 just with this indirect cost, not including the 8.8% other increases I'm hearing, which is going to increase our police contract close to $1 million, which is huge. So I'm just here asking that you folks take a look at this, maybe somehow see if we can take these costs out and expand them over the next 3 years instead of throwing a 30%. And some villages and townships are getting up to 50% increases. Somehow, can we just look at this and spread this out so it's not hitting everybody at one time so we can budget properly for our residents and for our proper departments? That's all I ask. The other thing too is yesterday I did ask what are these indirect costs, and I can't remember the commissioner who mentioned it. They said it's on page 19 of the max cap report of the 283 pages. So I printed this off that I did receive. I see a bunch of numbers here, but it doesn't show me how I'm getting charged for each of these costs. It just says how much allocated costs there are for 2022, the fixed costs, the adjustments. It doesn't tell me how these numbers came up. So again, I just ask you folks, I understand we need to give people raises. Our call volume increased, but we need to somehow look to defect these indirect costs over time rather than one lump sum. I appreciate the time. Thank you.
Thank you. Is there anyone else that wishes to comment in public comment at this time? Seeing no one, I will close the first public comment. We will have one again at the end of the meeting if someone wants to speak. So next item then is item 7, the Public Health and Safety Committee recommendations, starting with 7A, acceptance of the opioid settlement funds and the positions created. Moved by Commissioner Hoffman, supported by Commissioner Powell.
Sorry.
Yeah,
absolutely. Got in the loop.
All right, okay.
Hi.
Good morning.
Morning. Nice to see you all again. I'm Madiha Tariq, Deputy County Executive overseeing Health and Human Services. Leanne could not join us today, but I see a few folks from our talented and mighty team, so happy to answer any questions. Basically, why we're here today is to ensure that we can move the important work that lies ahead of us in addressing and responding to the opiate crisis. And this is not to devalue what's already happening. The efforts that we are putting forward is to really connect all of the work that's happening already in the county. So just a bit of background, which I don't think any of you all need, but the settlement, the lawsuit was filed in 2017. Actually, Oakland County was one of the first ones to join this effort because of how strongly we believe this can help us reverse, or not reverse, but moving forward, create better systems to address what's been happening in our community. We'll be receiving, as of right now, $38 million over the course of 18 years. So I want to make sure, $38 million over the course of 18 years, right? So if you think about it, yes, it may not be a lot of money, but there's so much collective impact that we can create around this. So what we're coming to you today is to do two major things. One would be to accept the funds that we, so that we can start doing our work. So right now we have about 5.24, okay, I can't keep up. Anyway, we have about 5.4 million in already that have been received. And the first thing we would like to do, which is my second request to the resolution, is to hire staff members that can actually help us move this work forward. So in the resolution, there was two proposed. One was for an epidemiologist, and then one is for a coordinator who can help us coordinate the decisions that we make moving forward. The county executive office is also thinking about putting together an advisory committee that can really, because one of the things that's a big priority, I know for everyone at this table, is to make sure everyone's voice is heard. So we are actually using the toolkits that was provided to us by MAC to really put together, just a committee that can help inform our decision. So that's kind of where we're at, and happy to answer any questions.
Okay, I see Commissioner Long has requested, and then Commissioner Powell after that.
Thank you, Chairwoman. So I watched Public Health and Safety, whatever it's called, yesterday online. So I saw your presentation on this yesterday, and I think there were some valid points made, and I'm at that point right now with a couple other commissioners in that on that committee. So I realize, my former life I was a nurse, so I realize the opioid addiction is very prevalent, and that I would welcome these funds and stuff. But I do think we're going a little ahead of ourselves. If we're going to have a steering committee, I don't understand why that steering committee wouldn't be the ones to recommend. Do we need one position, two positions? I guess I'm not sold. And I don't know how you're sold on that we need two positions at this time. And then when this goes away, these opioid funds, I heard that was gonna be phased over quite a lot of years yesterday. I forget how many years they said.
18 years.
18, I was
Yeah.
gonna guess 15, but 18. Are these positions going away? Are we keeping these positions? So I just think we're a little ahead of ourselves. I think we should do this, you know, if we can get the 5.2 million without having these two positions, why don't we do that and have a steering committee and let that steering committee work on what positions we need? So that's where I'm at. I'm just feeling like we're kind of jumping ahead of the game, which I'm not saying necessarily, sometimes it's good to be ahead of the game, you know, a little bit, but I just don't know how we can, you know you need two positions already. I guess that's my question. How do you know you need these two positions already?
So it's simple for us. What we think about is we need a person who can really help us create a data-driven decisions, right? So epidemiologists, and this is not just like us just coming up with this on our own. Other counties around the nation, including Kent County, have an epidemiologist that actually brings the data together. So the committee itself or this advisory board, you know, they can actually look at the data, we can look at the data collectively and use that to inform our decisions. This is also part of the recommendations that have been made nationally and as well as through MAC. The other piece for the coordinator, I mean, honestly, that I think that's really about us thinking about how we can create the most amount of transparency as a government body as well. You know, the coordinator will be the one, I think, and for me, transparent, I come from a community health background, right? So for me, transparency is not just us putting out a dashboard, but also creating an open line of communication where we're constantly able to receive the feedback from different members of the community. This advisory committee is gonna be what, like 15 people, right? To me, they're the grass tops, right? How do we get to the grassroots? And I think that's why the coordinator can really, I think, help us see through that. The epidemiologist, in a sense, is like your data specialist, and the coordinator is kind of your community opinion specialist.
Okay, and we don't have, excuse me, we don't have either of those positions right now, correct?
To be honest with you, what we've been doing is we have an epidemiologist on staff who has basically not been able to do her regular job because we felt it was really important for us to move forward. And I know Commissioner Raman is on one of the committees where she's also involved. But, you know, at some point she's gotta go back to her regular job, which is, you know, we're about to roll out a community needs assessment, you know, for the county, things like that. So help makes things happen, as you all know. You know, Leanne's team has always found ways to make things happen, but this is not just, I mean, we have the opportunity to invest and do things right, and that's why I'm proposing the two positions.
All right, now, is there any stipulation in receiving the funding, the 5.2 million, that we have to have these positions, or is this just proactive like other counties did?
What's been done is recommendations, so, you know, the settlement funds came with recommendations.
Okay.
So that's what we're kind of looking at, but we're not just looking at the recommendations because some of them are pretty, I mean, if you look at the toolkit, they're pretty like, you know, they apply to all kinds of communities. We're also looking at evidence. We're also looking at, yesterday, I don't know if you were listening, you know, OCHN had come in and talked about,
Yes, I heard
you know, how mental health agencies handle this kind of money. So we're looking at best practices from that perspective as well.
Okay, thank you.
Commissioner Powell, followed by Commissioner Smith Charles, and then Commissioner Raman.
So, I had made this statement yesterday because when we were focused on a housing trust fund, we had the board in place, but we couldn't move anything till we hired the, individuals to move it, right? So it's kind of like a similar situation, with this one. So that's why I was a kind of a yes vote, because we have went in this order before. And then I had gained clarity that we did have some funds to begin moving, because Joliet yesterday had wanted to clear that about the funding. And then my question to you though is, you just recently stated that you think executive is thinking about doing the advisory committee. thinking and doing it is something that we need clarity on.
Okay, yeah, no, we've absolutely, that's a priority. We wanna make sure we have as many ways to hear from the community.
And the only reason why I want you to clear that up because Commissioner Nelson was very big on, she went straight to the MEC toolkit and seen the lineup of recommendations of who is to serve on this advisory committee. And we were told yesterday that that is what we're kind of following, so I just wanted to clear that today.
Yeah, sorry, I didn't mean to make any, yeah, that,
No,
I'll make that
it's
clear.
fine,
Like,
I
this
just
is-
wanted to clear that there will
100%.
be an advisory committee to assist in this because we wanted to make sure we had the community input as well. So,
100%.
so that's all, I just need to clear that, thank you.
Thank you, thank you.
Thank you, Commissioner. Commissioner Smith Charles.
Thank you. And my question, it stems from just high-level understanding of what an epidemiologist does. Why is that a role? to
Sure.
play?
So epidemiologist is basically, the simplest way to put it is, it's a public health data whisperer, you know? So basically what happens is, in this space, in addressing the opiate crisis, there are multiple groups that are already in play. You know, there's multiple places where data is constantly being collected. So one of them, for example, we have an opiate fatality review, which is led by one of our partners, which I'm sure Commissioner Rahman can probably tell you a lot more than me. We have data coming in from our medical examiner's office. We have data that is responding to the latest innovations that are happening in addressing the opiate crisis. You know, OPVEE, for example, is one of them. Like OPVEE is the new medication that's out in the community. I'm sure the sheriff's office can comment more on that. So the goal of the epidemiologist is really to look at population health trends in the county and really ensure that when we make a decision on where this money is going, it's really informed by the best responsiveness that we've gotten to the innovations that are happening in this space. And when I say innovations, it means treatment, it means prevention and stigma removal programs, because if you look at some of the guidelines, like stigma removal has been a really big part of responsiveness to opiates. So this epidemiologist is basically a data scientist. So they'll take all the fancy data and maybe like translate it for all of us so we can understand what's really going on.
Right. And data is typically the high-level stuff, and then the information comes from the data. So I do get that. And I guess I just was wondering, and they say opioid, certain things affect people at their front door. I'm a little removed a little bit from this crisis, and so do let me know. This epidemiologist is not just looking at lagging indicators, because that's what I was thinking at first, was just looking back. Oh, what did the industries do to get us here? But you're saying this person is also currently going to be researching the negative health outcomes, things like that.
They're keeping their pulse on what's going on in the opiate crisis, right? So, and then as we introduce new things are happening around the community, they can respond back to us and they say, in this community, this was implemented, and this, or like, medical examiner's office is always sharing, new things that are happening even on individual basis that turn into trends. So this person can help kind of bring all those data points that are currently in silos together so that we can actually look at them in a more macro way as we make our decisions.
Thank you. Two really quick questions. Does this include the testing of like the wastes that Leanne was talking about? Would that be a component of data collection? That's just a high level for you guys as you're considering it. I was just curious, But then
right now, we don't test wastewater for opiates.
yeah, it would probably be hard to
in the
pinpoint.
county, right.
Things. So that was just a curious question. And then lastly, I was looking at the draft resolution, and usually it'll say like all of the, it says committee tracking, but it'll say like all of the eyes that saw it prior to it getting to this committee. And I just wanted to ensure that this particular item was reviewed by Corp Counsel per usual.
Oh, yeah.
Okay.
Yeah.
If I could just, that's actually on the item summary. So if you exit out of your draft resolution and
Okay.
select the item summary, you'll see the dates for those approvals.
Thank you.
Yeah, not a problem.
That's all I have.
Okay. Next, we have Commissioner Rahman.
Thank you, Madam Chair. Medea, thank you. Appreciate you. So to your point, yes, I do sit on the Opioid Fatality Review Committee, and I appreciate that Oakland County in general tends to be very proactive with these things, right? I mean, I've seen the work that's already been done just because I sit on that committee. So to answer Commissioner Smith Charles's, questions, really it's looking at data and what's happened in the past and how do we utilize that information to make better decisions moving forward. So I think as an epidemiologist, that's sort of what their role is. Obviously coming from a physician background, would be someone who's trained specifically to say, hey, look, knowing what we know about how this has been so messed up in the past, what are some safeguards or things we can implement moving forward to make sure that we keep our community safe and prevent this from happening again? My one question this came up yesterday, I was watching the same PHNS.
Sure.
I think one thing that I really wanted to drive home, and I know you mentioned this as well, is that we are following sort of the protocol template that's already put out there. So it's not us reinventing the wheel or just kind of out of the blue saying, well, we're getting all this money and let's just go figure out what we want to do with it. It's being driven and guided by a template that's been clearly vetted by both the state and national level organizations. And that's the other piece I wanted to really drive home. So I think that is important, right? So it's not just us willy-nilly spending this money, but it's very calculated. So I appreciate that as well.
And I'll say like the MAC recommendations are derived from the national, from Hopkins had looked at rural communities, urban communities, communities that are fairly homogeneous and communities that are diverse, and then they had created, so this is not, you might say, maybe MAC is not counting all of those different things, but MAC is deriving what they put out from a national study with Hopkins. And I think Oakland County is such an interesting place, right? Because we have all of those populations. So we're very excited that we have the support from MAC.
Okay, is that it? Okay, thank you. Is there anybody else Commissioner Weipert?
Thank you. See, I was able to watch the entire meeting yesterday, including all the public comment.
So you guys are just hearing my
Yeah.
show
But I
again.
don't
actually
know,
helped.
it does help, but I don't know if I picked up on that you have a staff position that's not able to do their regular job.
Yeah.
And I know there's a big need on this.
Yes.
And so, I watched our chair of that committee yesterday are we getting ahead of the game? Are you doing something that you don't need, but it sounds like you really need this.
Yes, we do.
And these people are gonna work the new staff positions, they'll work with the coalitions, right? They'll work with the community partners. I mean, they're gonna be the lead people.
Yes,
I mean, this is such a crisis that's gotta be addressed.
Exactly. Thank you for saying that, Commissioner, because I mentioned this yesterday. Somebody told me this and I'm kind of holding on to it. They said, we keep saying that the system is broken, but the system's not broken. It's disconnected, and there's all this work happening in silos. And I think this is our opportunity to bring people together. The money, whatever, right? Like in the end, it's $1, $2 million a year if you average it out. But the impact that these two positions can have in us creating collective impact, the non-financial benefits of this position and the sustainability that we can build in our system, I think is that is the biggest investment we're making.
And you work with groups like FAN and
100%.
our sheriff's department, have all the issues, right?
100%. We have FAN. As you know, we're working with the Opiate Fatality Review, so that's through. And now I'm like having a Friday brain on a Wednesday. Alliance of Coalition. So we have all these groups, and then yesterday you saw OCHN came up and joined us too, because they've been part of this conversation from day one.
And so, in their position, they're gonna work with all.
All of them.
Okay, all right, thank you.
Commissioner Rahman?
Thank you. Through the chair, if I can ask the finance folks, do we know how that money is being dispersed? I think this came up yesterday as well.
Yeah.
There was a little bit of muddiness. I wanted to just solidify that as well. So it's $38 million over 18 years. But my understanding is it's not really, at least as of yesterday, I didn't get a good sense that we have a definition of how and when that's gonna be dispersed.
It's, they've started dispersing it. I wanna say the first payment we got was probably about 6 or 8 months ago. We get payments, there are several organizations who are in the settlement lawsuit who are paying us. So there's like Walgreens or CVS, and it's all kind of separate. So we get some money from these organizations. We've had a couple of the pharmaceuticals file bankruptcy. So there's some of that money that's like kind of being held up. So we do have a schedule, and I can share it with you, that is pretty much just the best guesstimate of what we're getting. Right now, we do have like 5.1, 5.2 million. We have it in a separate fund, the opioid fund. You'll see it in the financial statements this year. And there is, some of those funds have been carved out for opioid treatments at the jail for the MAT program. So there's like $475,000 a year so far that this body has
We have that.
approved for the jails to use. And so when we do get the funds, they're coming in different tranches. So it's not like we're getting $2 million every January on the 15th. We get, like, for a while, we'd gotten like $325 and we weren't sure what it was, $25,000, and we weren't sure where it came from. We knew it was opioid, so we kind of have to wait for the database and the website to update to let us know where those things are coming from. And we did just recently, in January, they put out a new schedule, so there was an additional Walmart was put on it, and one of the other organizations that had filed bankruptcy, they had come to an agreement, so their amount had been set, and so that got added to the schedule as well. So it's kind of flexing right now, while everybody's just trying to get in the groove of, okay, we're gonna start paying it, and then we also have reporting requirements that will come with the opioid funds that we'll have to do as we start, dishing them out. Right now, we've held most of them, and we've held all of them. And as we start making those expenditures, we'll have to do annual or quarterly reporting. I haven't looked at that very closely yet because we haven't spent any of it.
Sure.
But we'll have those reports that go out as well to make sure that we're staying within the guidelines.
Perfect. So with it not being in tranches and being sort of flexible, will that create any logistical challenges for the things that we're looking to do? Because it's not as consistent as $2 million a year.
I don't think so, because we started getting the money
Okay.
and we've had the money for a little while, so we have that,
You've
like,
built up a
that
reserve.
$5 million is there.
Got it.
That cash is there, it's in an investment, and that's, that's money that we have. So as long as, and Medea, kind of like, her and I have conversations about this, so I would never tell her it's okay to spend $6 million.
Yeah, sure.
So, we're all kind of working together to make sure that we're using the highest and best use of the dollars that we're getting.
Perfect. Thank you.
Thank you.
Okay. Anybody else have any other questions on this? Seeing none, let's prompt the vote.
Refresh anything? Nothing.
Whitebird,
I'm a yes.
As long as it's proactive.
Smith Charles,
With the data.
Oh,
Yes,
I wondered, I wondered.
Robin,
Oh, no, Thursday.
you have 7 years, 0?
You know.
Okay, motion carries. Thank you, everybody.
Thank you so much. I appreciate all of your support.
Next, we have item 7D, amendment number 2 to the Michigan Department of Health and Human Services fiscal year 2024 local health department agreement. I need a motion. Commissioner Powell, supported by Commissioner Smith Charles. Okay, who's presenting on this one?
This was the lead.
Stacy Sledge presenting on behalf of Leanne Stafford. What you have before you is amendment number 2 to the fiscal year 2024 local health department agreement. We received a little over $2.1 million, which includes funding for some of the mandated public health services. And in addition to that, we received $120,000 to purchase a Class C recreational vehicle for mobile outreach services provided through the harm reduction services. And also we're issuing a subrecipient agreement with Remembering Cherubs in the amount of $23,529. I would be happy to answer any questions.
Okay, thank you. Commissioner Hoffman, followed by Commissioner Weipert.
What is a Class C recreational vehicle?
We actually have Kate and Jen Erskine here. They can speak on that.
Hi, everyone.
Hello.
It is good. I'm sorry I'm not there in person, but it's nice to see you all. It's the typical RV that, Jen will have the size dimensions, but the kind that you would take camping yourself that doesn't require the additional chauffeur license or anything special, that has enough space that it has a bathroom inside. That's the key for this mobile outreach vehicle, is we really need the bathroom facility so that we can do the urine-based testing for sexually transmitted infections that we can't do in our current transit van model that we have.
Thank you.
Good.
Mm-hmm.
The bathroom. Very specific. Commissioner Weipert.
It's basically the same, similar question. I watched this yesterday. You guys presented at Public Health and Safety. And I mean, what are you doing now? I mean, you go out and you test and you can't wash up,
Yeah,
can't clean up. I mean, there's definitely a need for this. I mean,
Definitely a need. We're not providing sexually transmitted infection testing on our mobile outreach unit. So we're doing the syringe exchange, the harm reduction services, the counseling, the outreach, but we can't actually test individuals for STIs while we're out at outreaches because of the lack of a bathroom facility.
Wow.
I saw Jen raised her hand too.
Okay.
I don't know if she wanted to say something.
Jen, did you want to add something? Okay.
No.
Thank you.
Anybody else have any questions or comments on this topic? Seeing none, let's prompt the vote.
Will you do a voice vote here?
Oh, yes.
You have 7 yeas, 0 nays.
Okay.
Thank you.
Motion carries. Thanks very much.
Thank you, everyone.
Okay. Next, we have item 7C, the establishment of dispatch service agreement rates from April 1st, 2024 through March 31st, 2027, and the positions creation.
I'll move it.
Moved by Commissioner Smith Charles, supported by Commissioner Powell. Nobody wants to jump in today.
Not on this one.
Okay, we have the Sheriff's Department before us, so floor is yours.
Good morning.
Morning. So I apologize for everybody that watched it yesterday and go through the same spiel and hopefully add some stuff where we left it out yesterday. So as you know, we've established the dispatch rates for the next 3-year agreement. This was a collaborative process. We always start out the agreements and we work with Corporation Counsel and Risk Management on the language in the agreements, and then work with Fiscal Services on the establishment of the actual rates. So the fire rates, the cost per call increased from $35.49 to $40.19 for the first year in the agreement. Police, the cost per full-time equivalent officer increased from $7,535 to $8,216 for the first year. We have 15 total just fire dispatch agreements. We have 6 police agreements. And then this rate that is established for the per officer is also incorporated in the law enforcement agreements that you'll see later on this year. Police and fire agreements, we have 4, and then emergency medical dispatch agreements, we have 1, and that's with the city of Pontiac. So the majority of the communities had an increase in the average number of calls based on a 3-year call average. So it's a 3-year agreement, which is why we use the 3-year call average. Obviously, if it was a 2-year agreement, we would use the 2-year average and so forth.
So what I do want to clarify though, because I know there was some discussion previously on the Oxford tragedy, and that day, obviously, we were flooded with calls, and that they would have been charged for thousands of calls that day. That's not how it's registered. That incident would be registered as one incident and one call. So even though there were thousands of calls associated with it, their call average did not go up because of that. So just for future reference. And then most municipalities, based on the last 3-year average, that their last 3-year average had COVID. So obviously the calls, there were fewer calls during COVID. So it's a kind of a compounded increase. So some of the townships obviously have experienced growth and a higher average number of calls, but the average is also higher than the last because we had COVID factored in before. The largest dollar increases were for personnel. Obviously, we had union increases and general salary increases, and some of them were larger than we've seen. They were kind of unprecedented increases to keep up with inflation and to make them whole. So the command union and deputies union had retroactive increases, and so those were all incorporated in these rates as well. Then the other thing that we've incorporated were indirect costs, and we've had a lot of discussions around those. This has been an ongoing discussion from 2021, where we phased them in with the patrol agreements. The expectation was to incorporate these in all county services agreements, so not just law enforcement or not just the sheriff's office, so it's supposed to happen in all agreements.
Oh, that's what I was gonna ask too.
And then the indirect cost rate that was used, that was applied to the salaries budget, not salaries and fringe benefits, so it's just straight salaries. And we've also asked for positions, a full-time or dispatch leader position with these rates and this agreement, and then part-time non-eligible warrants clerks positions. There's an increased workload, and their workload statistics support adding multiple positions, but obviously we try to cover any of our costs internally. We try not to come and ask you for additional money for expansion. So obviously with the increased rates, we have the funding to incorporate a position, but we kept it conservative at one, even though they could use multiple positions. And then part of this alleviates overtime, because obviously they're 24/7 operation, so they still have to do the work whether they have the positions or not. So we're here before you asking for support, and I'd be happy to answer any questions.
Okay, so I see Commissioner Long first, followed by Commissioner Powell.
Thank you, Madam Chairwoman. I just first want to go on saying I love the Sheriff's Department. I'm a huge supporter of them. I've been for the whole time, even before I was on the board, but I think they do an excellent job. So it's nothing to do with them. I believe they need their raises, as Supervisor Gray said. They work hard, the dispatch and the road officers, patrol officers. I'm a little disappointed the way this came about, I guess. I would like, a letter going out, to start it with it gives me a bad taste in my mouth, but a letter going out to our local municipalities that we didn't know about, that specifically stated Board of Commissioners are making this policy for indirect cost, and so I know you guys know now because we talked to you guys, but we got all these calls. I had no idea this letter went out. I had no idea about indirect costs were coming up. So it kind of just blindsided all of us, I think, with when we got the phone calls and had to call and find out what this meant. So I guess to me, started off very bad. So I only can imagine that I think the municipalities, it didn't start off so well either. I agree with Supervisor Gray. I think they needed time to budget for this. Now I'm hearing rumors that the sheriff's contract is gonna go up way more also. Their budgets are not like our county budget. Their budgets are, I don't know what Commerce's is, it must be over 11 million now, that's the last, but it's your total budget. So when you're thinking and something's gonna go up 300,000, if your budget's 11 million, that's a lot of money. That's a lot of money. So I too was hoping that if we're gonna do this new indirect cost, which I've never saw in a contract before, and if I'm wrong, I'm wrong, but this is the first I've noticed that written out like that. could have been phased over or should be phased over 3 years without just doing, a one-time lump. Some municipalities most likely, or maybe will have to go out for increased public safety millage with this that are, and they need time. Their budget's passed. And I just think it's a huge chunk of their budget, and I just don't think it's fair to local municipalities. So I don't think over the 22 years I've been here, I think I might have voted on copy machine once at the sheriff's department. No, I don't remember hardly ever voting no. I've always supported the sheriff's department on the helicopters, on everything, but on this, just the way it went down and stuff, I cannot support it. I think there is a way that we could have worked a little bit better on this. A month ago, I was told, yep, we didn't know about this. Let's go, maybe we can negotiate something to phase it in. I never heard anything about phasing it in, and here it is in front of us, and it's just hitting the municipalities with the increase all at once. So I can't support it the way it's written out today. I wish that we could have negotiated something to help the municipalities. I know they do a great job. I know they deserve raises. I don't want anyone to think I'm against the sheriff's department because I'm a huge supporter and I promote sheriff's department all the time on everything. They're very professional and do a great job on everything they do. So I just don't like the way it came about, I guess. And I just don't think it was fair to the municipalities for these increases to not, so they could have planned for it more, maybe phased in over 3 years, and then they're gonna get hit with the contract one too. So I'm just a little disappointed at how when came to us this time. So that's it. Thank you.
Thank you, Commissioner. Commissioner Powell.
So as I stated yesterday, Chairman had addressed our caucus at our last board meeting and let us know that him and the Sheriff Bouchard had a discussion about these rates. What we had asked for previously as caucus members is that we get clarity on indirect costs. We were approached by several fire and police yesterday from these municipalities that they are still confused on the indirect costs. So my issue today is it's unfair for still us commissioners have some questions on indirect costs. And then for these municipalities to come, and we did share with them that Nexus report, he's researched and came back and said that report is not clear. I just think that for all of us to be on the same page, and all on the same page, and be able to move forward with clarity, because some of these contracts, like they said, I don't understand that percentage stuff either, but for the most part, that is a big jump for certain municipalities. Be it if, in their budgetary discussions and stuff. So I just want us to get clear understanding of the indirect charges. And so I do see Chairman Woodward online. I don't know if our chair is gonna allow that to have him to have some words, but I would love to gain some clarity on what is indirect, because they are not clear, as we had about 5 of you yesterday. Yeah, come in, so I think that's a lot. I just think that's a lot that we need to just gain clarity. So that's just where I'm at.
So the chair is here. Would you like him to address your question?
Yes, please.
I am here. Well, let me address a couple of the points here, and then fiscal service, which I believe is in the room, can.
Oh, you're kind of breaking up.
But,
Let's close your camera. It should be better.
Okay.
Is that better? I switched off my, is that better?
Yeah.
I just switched off my camera.
Okay.
Yeah.
Okay.
You can see your vehicle.
At a high level. Okay, yeah, but I'm not driving, so for everybody, I'm not driving.
I know, I noticed he was patting her.
So, I am, so at a high level, and fiscal services can go into a lot more detail about the report that calculates the indirect costs. But it should be noted that these rates in total calculate what the true cost of providing these services. The county is not making money on these contracts. It's the intent is to put forth a rate that fully recovers the costs associated with the service. To Commissioner Long's point of view, and a little bit similar to Commissioner Powell's comments, And everyone knows that I've expressed my frustration. I've had a number of very good, productive conversations with the sheriff's office, but not just sheriff services, but all, that we need to get in front of this a lot more. And so staff is working on a process to ensure that rates will be determined first before actively communicated to customers, in this case, namely our CVTs, for things in the future. We're a little bit behind the 8 ball on this one because this contract expires at the end of this month, and we obviously need to have dispatch services in place. So when it comes to the incorporation of indirect costs, these indirect costs, and I would let the experts in terms of fiscal service to talk about what's included in it, and if we need to bring the consultant that helps calculate this for us before the board to go in greater detail on how it's calculated. It is a complex process, but it is not something that's not customary. And frankly, frankly, this issue should have been taken care of a long time ago. So without speaking out of school, if I could just defer to fiscal service in the House to talk a little bit more in detail of the components that make up that indirect cost.
Thank you so much, Chair.
Thank you. Cheryl's coming to the table.
The seat's already hot.
Sometimes I don't like that.
It's so fun.
Hello. So indirect costs, the company that we use to calculate our indirect costs is a federally recognized organization that calculates indirect costs for grants and other federal organizations. They're federally recognized and accredited to do these calculations. We don't do them in-house because they're extremely complicated. Bigger municipalities use Maximus. I know Pontiac used to use Maximus. And what they do is they look at, we send them detailed journals and transactions of all of our activity throughout the year. And then they take those transactions and look at how many pieces of mail are processed, how many checks are cut, how many invoices are cut. They take all of the stuff that it costs to run the sheriff's department. Gaya's time, fiscal's time for doing the invoicing, all of those things that it costs to run that organization, and they come up with a calculation on what that percentage of the salaries are that make up that amount. If I recall correctly, the amount was like $7 million is indirect costs. That's how much it costs to run a sheriff's department outside of having any deputies and cars or anything. So those are the costs that we're looking at in trying to figure out how much it costs to run a sheriff's department. So adding that into the rates is something that was decided because it is an additional cost. If an individual organization, if Commerce had their own sheriff department, they would have these additional costs as well because they would also have copy machines, computers, people support staff, phone calls, things like that. So it's just a way to calculate how much of all of the stuff that basically the administrative stuff that it takes to run the county and disperse that to the other individual departments. It takes almost 300 pages of just documents to explain it. And, I can't even imagine how they do all the calculations. It's a lot of this and times this and this. So I think that Chairman Woodward had a really good idea, and maybe I can ask Maximus to come in before any of the boards that are interested and, explain exactly what goes into it. It is not going to be a riveting conversation.
Can I just ask one thing on hers?
Let's see, Commissioner Long.
Just because, can I ask something that you said, and I think it will help everyone?
I think Commissioner Powell still has the floor.
Oh, okay.
Just about that. Well, when you say indirect costs, so just to be clear with those firemen and police that came yesterday, indirect costs is basically the operational costs to run the sheriffs and it's imposed, well, I don't wanna use that word, but you know, they then.
It's calculated.
It's calculated, okay, so it's all that, just it's operational cost,
Right,
it's
there's-
indirect.
They look at like building square footage to determine how much, like what the percentages of the building square footage that the sheriff takes up compared to the entire county as a whole. They look at all kinds of things to figure out who's paying the fair share of the structure of Oakland County.
Okay, so, yes, the consultant needs to come
It's
break
overhead.
down. I just think I think, okay, so I understand it, now I feel so much better, cause I at least understand the space
Yeah,
of
we don't know how to do
where
the
indirect is even, thought of, right? But I think it's still pertaining to these contracts. I think it still would be good for us to eventually, well, I know for myself, and if our chairman allow it, for us to just understand how that all was formulated with these contracts, because now it's good that they at least hear what is all encompassed in this cost. But just for our knowledge, because a lot of our commissioners needed to know, especially because they serve these areas and they can better explain, but that's just where I'm at, so thank you, and I'm done, thank you.
Okay, Commissioner
I just have
Long
one thing
had
for
one more comment.
Yes, just for Cheryl. The 7 million that you said is the indirect cost of the sheriffs. So will that be, that 7 million indirect cost be on the sheriff's contracts spread out and the dispatch? That cost? So you're saying it's 7 million a year of indirect costs?
Yeah, that's what the dollar value is.
Okay.
And then they do calculations to figure out what that percentage is of salary.
Okay.
So then they take that percentage, and so then if you're only using 4 sheriff deputies, then it's 7% of the cost of those 4 sheriff deputies covers that part of the overhead. And if you're using 10 deputies, then that 7% is 7% of those 10 deputies' wages. So we take the costs of the dispatch team, and it's 7% of that is how the rates are calculated.
For individual, but as a total package, I don't know if this could be answered, is that 7 million? Then it will be spread over the contract, the road patrol contracts and the dispatch, or what?
It will be applied to those
positions,
because we do have some positions that are deputies for the county.
Okay.
And so we pay those costs because that's our overhead for running Oakland County sheriffs that control Oakland County. So so the whole thing doesn't get put on outside sources, it gets spread between the whole.
And how many positions they have, and then it's multiplied by that calculation, that maybe if we can get the.
So if I may, if it was fiscal.
Okay.
And it was a percent of fiscal costs,
Okay.
that wouldn't go to anybody because I don't outsource any of my services to any of the communities. So fiscal pays that entire overhead cost for that. But because obviously we have a larger sheriff's office, because we do provide services for so many communities, our overhead costs are larger.
Okay.
And that number, that 7 million, it'll change every year.
Okay, yeah, that's what I was
So right now, they're taking the information from 23 right now, and they're gonna have a report for me, and I will put it in 25's budget. So it's always 2 years lagging behind because they take actual dollars of what it cost and do the calculation. So the 7% was from 20 or 21, and then the following year was 10.5%, and then the year after that was 8.5%. So it's gonna fluctuate depending on how much staff you have. You know, if we had a lower personnel pool, then the percentage might be higher, cause it still has to cover that full amount. The percentage is just a way of dividing that cost up to who's actually using the services.
So I eventually would like to have a meeting with that calculation, I'm a numbers person like that, to see that cause that would help me understand it better. Cause now I'm hearing that it's position charge, so if we had 10 dispatch positions, then that 7%, that will be added on to that individual contract of only those 10 employees.
Yes.
So that 7 million's not, it's spread out, but it's not spread out, it's spread out per calculation per municipality.
Yes.
Okay.
Yes.
So that would help me to eventually see that calculation, even if I don't understand it, can't perform the calculation.
And the book
but-
is online.
Okay.
I'll make sure I send a link, cause
Okay.
it's in a couple of
I like
places
seeing
and I
stuff
always
like
have a
that, cause
hard
then I
time.
understand it better when I see the actual calculation,
It's-
just like the
I-
road funding.
I'm
you
gonna
see
warn you,
that.
it's like 280 pages of just
Oh, well,
numbers.
that's good nighttime reading.
Well, that's fine. Well, it's a good nighttime reading, but I will be working, make sure staff works with Cheryl to bring the vendor in to give a presentation to get more in depth on this.
All
And
right.
it's timely, particular on future rate setting that ideally will happen before rates are communicated out to customers.
Okay, thank you. Thank you for letting me, because that was related to 7 million, so thank you.
So I have lined up here, Ajay, Commissioner Rahman, followed by Commissioner Weipert, followed by Commissioner Powell again.
Okay, I'm done.
Commissioner Rahman, you're next, and then Commissioner Hoffman, can you make a request? It helps me. Please, thank you.
You might have to fall back off.
Thank you, Madam Chair. I think my fellow commissioners, Long and Powell, articulated it really well. I have a lot of the same thoughts. And Cheryl, conceptually, I 100% agree. And it makes sense that if you're utilizing a service, to pay for it is a no-brainer. I think for me, where the disconnect is happening is the level of communication, right? And Chair Woodward mentioned this too. Whether it's us as a Board of Commissioners, we're not ahead of this, and this was sort of snuck onto the CBTs without our knowledge, is problem one. And then problem two is the fact that the CBTs are coming here and telling us, hey, look, we're in support. Collectively, we're all in support of the Sheriff's Office. We appreciate everything you do. Everybody wants to make sure that you have all the resources you need. But if, even as of today, the supervisor is telling us, hey, I don't really understand these indirect costs, these don't make sense to me, I think we have a duty, a fiduciary duty to our CBTs to make sure that they understand exactly what it is they're getting.
Right.
And I have a problem taking this vote today without them necessarily having that understanding. Because it sounds like he's able and willing to pay for what they should, and I don't think anybody's disagreeing with that. But if he doesn't understand where these costs are generated from, to your point, we're paying for the building and the copy machine, or all of those things are fine. But I think ultimately, if they're the ones footing the bill, they need to understand what that is. And I don't know if there's a way for that to happen prior to taking this vote, or if we have to take this vote today. I don't know if there's any option to postpone. I think it's at the end of the month or beginning of next month that this renews.
April 1st.
We do have another finance meeting before the end of the month.
So I guess my request, if it's per the, with the chair, if it's worth potentially kicking this can down the road for 2 weeks, giving us the time and ability to get that information, present it to the CVTs, have some of those conversations, and make sure that they're okay and they don't feel like this is, shoved down their throat, against their will.
The issue is the next board meeting. The next board meeting is until April. So if we were to give time, it would probably be, we would have to come in earlier prior to caucus
Extend the
and
contract.
try to have a finance
Well, I
probably
guess
from there.
Extend the
It's not a
contract.
board meeting and it's not gonna be able to happen. That's before the end of the month.
So my-
It's not time.
So my question is, if that's the case, and I appreciate that, I know it's not germane to this conversation, we're gonna be talking about the first quarter financial forecast. The sheriff's department is already over budget at this point, for first quarter, and that's a whole other discussion we'll have when that comes up in conversation. But is there any way to go past that April 1st?
Yeah, that's what
There's so many contracts we don't renew until 6 months after the
Right.
fact, when someone discovers it and says, oh, well, we forgot, we didn't know, this is retro 6 months ago.
Right.
I've seen it all the time in the 1 year I've served in this capacity. So I think for us to even bypass that April 1st and let it go for a week, if that's the case, or whatever it is,
30 days
or 30 days, or whatever it looks like, I think would be a reasonable approach to make sure everybody's content with this decision. And we're not taking on a vote that's, at least leaves me feeling very uneasy and uncomfortable.
Okay, couple of things. So staff tells me that we really do have a firm date at the end of this month because we're dealing government entities to government entities. And I think there is somewhat of a desire to postpone, potentially to try to resolve this at caucus before the next board meeting, which is a week from tomorrow.
Morning. Yeah, it's a Thursday morning one.
Right. Madam Chair, can I jump in there?
Sure.
To Commissioner Rahman's point, and we can keep having the conversation, but the cost is the cost. And so my request is, if the committee can advance this so that we can take the question up on Thursday, we will have a larger conversation in caucus. We can have as many conversations leading up to there. What I don't want us to intentionally not take action on something that, like, we're stuck in this position. And so where, to Commissioner Rahman's point of view, where there have been instances where something has slipped through, it has. This is something that's in front of us, and while we are staring down at the deadline, there is no dispute, like, the cost is the cost. I realize that there's probably some value over the next, particularly next week, to have these conversations with each individual entity. We can do that and then talk as a caucus and how we want to proceed at that point. But there aren't a lot of options. I mean, frankly, postponing will just probably increase the cost of the contract. Because we'd have to make up the difference between now and then.
Thank you, Mr. Chair. Cheryl?
Through the chair, if I may. I know that staff informed you there is a deadline. This contract is typically April to the end of March. I don't know why, and there could be a reason, but I don't know why we couldn't, probably through this body, extend the contract 2 months and give everybody time to have some comfort level with what's going on and get some additional knowledge about, I'll try and get Maximus to come in. I think obviously it would take a vote of this body and the board to extend the contract, because I don't know what's in the contract specifically for extending the time frame. But then that would at least allow us to Chairman Woodward's point, it would kind of be kicking the can down the road, but I kind of feel like Switzerland in the sense that it might help people get the information that they're looking for and be able to make a decision. And then we would be able to have that conversation with the CVTs, and you guys would be able to have a more comfortable conversation with your CVTs.
Right. And
so I feel like that is a recommendation, but it would have to come through, obviously.
I agree. I think if it could be.
So
Is it possible?
I guess I would point at putting it at 2 months, it delays the creation of these additional positions that are needed to support the organization.
Separate it.
Well,
And we redo all the agreements because all of them are calculated based on the rates at this point. So everything would change. We'd have to update every agreement and resend out everything to the municipalities. So
So what I hear is there's a couple of options. One is we can postpone till next week and then
anything's gonna happen.
have some sort of firm decision at the board meeting, or we vote to extend the contract for a couple of months. But I wouldn't want to see it extended beyond the end of, say, April.
Sure.
I think that's plenty of time to hash this out.
Well, Madam Chair, if I could just one last thing.
Sure.
The hashing out, I think there's the communication aspect.
Right.
And we need to accelerate that. But it's not like the numbers are going to change. The numbers are what they are. And so then at that point, like, what are we doing? And staffing up at a level to best provide the service is also a priority. So nothing changes.
Right.
I get that, but.
So my question, first of all, I want to make a statement because I don't think it's been made clear here. The chair keeps saying the rates are the rates, and that's true. A question that I have that has not, maybe this is not the time or place to bring this up, is how come this showed up just now? Right? I think I know the answer to that, and I don't want to state it here, but this is a problem that needs to be fixed. And by trying to fix it, the CVTs now are stuck with a big number they weren't expecting. And that's a problem for them, and that's fair.
Right.
So one question I might have is there a way, well, I won't go there. I won't ask a question at this point. I have a couple of other commissioners that have questions, and then
I may be about to ask yours.
Well, Commissioner Rahman is up, and then Commissioner Weipert.
Well, I just wanted to quickly address Chair Woodward. He's not wrong in the sense that the numbers won't change,
Right.
and I get that. I don't think anybody's asking for them to change.
No.
But a little bit of transparency and communication that has been lacking to this point would go a long way in at least helping the CVTs maybe understand, or if by chance there is something that shows up when we do our due diligence, it would give us the opportunity to go back and maybe correct it in the off chance that that exists. That was my only point.
Well, right, okay.
Would have been nice, phased in.
Commissioner Weipert.
And I agree with the other commissioner. I mean, you guys have heard, yesterday we heard from Brandon and Oxford and Commerce, and I've heard from Lyon and Milford, and I'm sure you have heard, and Hamel from Highland, right? All the supervisors, Supervisor Green, Hamel and Dolan.
communication with most of them, yes.
You've heard from everybody, right? So they're making contracts. The whole history is they've been happy with the service of the sheriff's department. And they've never had complaints about that, so we're stuck where we're at, but it's not fair to them to have to force a decision right out of the blue, really. So I'm for a 30-day extension, let's get the
60, you say.
30 or 60-day
I mean, they're
extension,
gonna have to
keep
do
it
all
as
the
it's
paperwork again
extended
Are we,
and see, but I don't know if we can,
well, let's clarify, are we saying a 30-day extension at the current
at the current rate.
current contract at the current rates?
I'd make the motion. Yeah, if we can do that.
But I thought that can't happen, cause 30 days from today, that spills over to
We're
mid-April.
extending the
No, that's
existing
April
contract.
first.
Extend the
It would go
existing
April
contract.
1st to May
Oh, we just extending the
1st,
contract.
maybe to May, I would put a date on that. Actually, I would put a
For
date,
the department to go back into
because it
negotiations.
could be the April 30th or May
Right.
1st, I would put a date. If you do that, I'd put a date,
I think I could probably
Let's
answer
make
that.
it 30
mean,
days, not 60.
but then I'd put like,
Address it again.
I'd put May 1st or April 30th.
30 should be enough, so.
Is that May 1st, and I would put
It would be April 30th.
So,
You gotta make your motion.
Well, we can define a date, right?
Right, I think you better put a
So-
date.
So if we put a motion, we can pick a date and just make the motion to support
Well, no
that
matter what, they said they're
date.
gonna have to rewrite the whole
Rewrite,
contract.
exactly. So either way, it has to be
So it's gonna be a
rewritten.
lot of work, so if it's
yeah,
30 days or
so
60,
should
now
we
it's
date, right?
expect
it's a lot of work.
to change in 30 days?
Right,
The rates aren't gonna change, the rates are the
don't know.
rates.
right.
It's
And
more
that's
so
not giving
giving
them,
us
I'm out of order, but 30 days doesn't give the municipalities any more time to come up with the money either.
Right,
I
right.
mean, that's a big issue, the phasing in would have been better for me.
That's where my question is
Yeah.
when we get changed.
I'm out of order,
Okay.
sorry.
So, we're still on Commissioner Weipert, are you done?
Yeah, it kind of went wild here.
Right, I know, I'm having a hard time controlling all of you
said sorry.
folks.
Right.
Okay, if-
And not to, I'm not throwing you guys under the bus, I mean, this came up, we wish we gotta have a better process in place, cause you're offering a contract to the CVTs, and they have to have a time to look at and review, cause they're not in a position to make new plans, right? If they had 6 months' notice, or 8 months' notice, or a year's notice, they might be able to get services otherwise, or budget, or some of them gonna need, you heard, they might need a millage. I mean, or increase the millage, to do that is, that's a year planning process, so we've got to try to sort this thing out so
He
that
said
it's,
millage,
it's
okay.
fair to all the CBTs. So
so,
that's,
I don't know
Yeah,
if 30 days is gonna do any
there's
difference,
a-
they gotta come up with the money.
there's a point I'd like to make to the CVTs who are affected by this, that your rates went up. There are a number of CVTs who pay taxes to Oakland County who have their own police departments and are literally subsidizing the indirect costs for the communities that don't have their own police department and are using us. So by making the rates what the rates are, it resolves that for the rest of Oakland County's taxpayers, right? So we're talking fairness, we wanna resolve this. But again, I don't see that a 30-day extension is gonna do anything except create a whole lot more work than what you've already just done. So I guess the choice, let's see, I have Commissioner Powell
So I just wanted to see, with the CVTs, clearly they know the rates is coming, they are aware of their amounts that they're gonna be having to take care of. Is there room for them to have discussion on, and I don't know if this is an option, like phasing it out and all that, is that options in this stuff? Or is year by year and they just gotta pay that bill?
Well, absolutely. I mean, this is, at the end of the day, it's a policy decision. So whatever, we are going by the directives we were given, and that's what was included in these rates. If you decide that you want it phased in, you want it lower, you vote for anything. So really, nothing's gonna change for the CVTs unless you decide that you want a lower rate, lower percentage, a lower amount in these. Then we go back and we recalculate, and then it's different, it makes an impact for the CVTs.
So
Other than that, nothing's gonna change.
So fiscal with just a question, I'm not saying this could happen. Is the, like a phase out option even there, or no, not with these type of contracts, they have to be, paid within the year?
That's what I would like.
Well, we phased it in with the law enforcement contract, so the current law enforcement contract has a small amount of indirect costs in there, and that was the intent to phase it in. And then, obviously, there's been other discussion, and the director was like, no, now we have to go full, so.
That's what I'm saying, why don't we just
That's what was
So,
instead of
Chairman,
postponement, why don't we just phase in?
is Dave on there? Dave?
Commissioner Woodward,
I'm here. Yes, I'm
So
here.
with this phase out option that we've done in the past, is that even an option with these contracts? This is just a knowledgeable question. It's
Yeah,
not
I
saying,
think instead of
should we do this? It's just me just asking for clarity because
Sure.
our leaders of the communities are aware of the rates. But it's just that they, the timing and for their budgeting purpose, they was just trying to really see if there was a workable situation in that option. So I just wanted to know if that's an option or not.
Well, so again, this is why it's really important that we set the rates before we get to a place of establishing contracts with local communities. At the end of the day, the board will set the rate. If we don't set the rate at the cost it costs to provide this, then we are in effect subsidizing the cost of the service. And so where does that money come out of? We're not, it is basically the service is costing more than the revenue coming in to pay for it. And then those are opportunity costs of using those resources to pay for its basic service, which means it has to be drawn from another pot. So that's the
response.
The argument is that it needs to be a direct action if we're going to ever subsidize something. Maybe it is a hardship or something, but getting us to a position where the full cost of the service is borne by the contract is the fiscally responsible thing to do.
Okay, thank you for the clarity.
thank you, commissioners. Next up, I have Commissioner Hoffman.
Thank you.
He waited
Thanks for-
good.
thanks
He
for
was
plugging
quiet.
in.
He was quiet too.
When
He
you
was waiting
figured out, before they started adding indirect costs, and first of all, the end result would be the same. I think indirect costs should all be in the price of providing the service, and it should be one price. It'd be like me and my business giving a customer a price for doing something, and then, oh, by the way, I have indirect costs here. I'm gonna charge you for my copy machine, my accounting, my electricity.
Put that in your
Overhead
price.
should all be calculated into your price, I think. But when you calculated the rate prior to this indirect cost conversation, how did you calculate it? Was it just labor and cost of that and equipment, and there was no other thought of our insurances or anything like that? We never had any, we had some indirect costs maybe, but not what we're doing now.
Well, dispatch is calculated a little bit different than the law enforcement rates. The law enforcement rates are by position, so it's the person, the fringes, everything, the operating the car, the taser, the whatever, all of that goes into that. With dispatch, it's a little bit different because with fire, we're trying to get a per call rate. We don't have positions, so it's a little bit different. It's on the budget as a whole for dispatch. And then they break it down by workload statistics, so it's broken out by a fire percentage and then a police percentage and a non-contract. So we take the percentage of the budget for fire divided by the number of average calls, which I think at this point was like 55,000 calls. So we took the portion of the budget that's attributed to servicing fire and then divide it by that number of calls. That's how we got the $40.19. So previously, and then that indirect cost rate is on top of the salaries budget. So previously, we did not have that in there. So that's the only difference with this calculation.
So for dispatch, then all we had in there was the cost of labor and the fringes and everything else.
Well, everything, their whole operating budget is in there. So everything, I mean, it does, so essentially.
Equipment and.
Yeah, so all their internal services, everything are factored in there. And then this is the, like, the administrative fee on top of that, that's calculated by Maximus.
Okay, and I support kicking the can down the road till like the end of April. I don't know what your motion is, but.
Okay, last person on my list is Commissioner Long for last.
And I'm very sorry, I didn't want to go here, but when we talk about subsidizing, you have to remember these same communities are subsidizing mass transit. Sorry, I mean, Commerce pays $2 million. Yes, we are. We pay $2 million and People's Express with 7 communities in it gets $500,000 back. Commerce alone, isn't it 2 million on our millage? We're putting in 2 million and 7 communities out in our area are getting 500,000 back. So we are subsidizing mass transit. Might be a different topic, but then for you guys to say, we don't wanna subsidize, the sheriff's department, we're subsidizing your mass transit, and I hear nothing about that. Sorry, it is true. It's all the townships that use the sheriff's departments are subsidizing mass transit. It got voted, so that's their vote, the way people voted. I don't think they were educated my way enough, but it passed and we're living with it. And I think they've been very good players at the table for it. So, I think we just have to work with the municipalities a little better because there's other things that we do subsidize in the county, so.
Madam Chair, I mean.
I know that's not germane, I'm done.
That's an inaccurate analysis, but I will stop there.
I think it's a great one. I thought of it last night. Thank you.
Okay,
That's what I'm saying. We get
Commissioner
500,000.
Rahman, you have one more.
Yes, sorry, last question I wanted to ask for you, so, and again, this isn't entirely germane to this, but I know Gaya had mentioned too that the sheriff's contracts will be coming up later this year as well. I just wanna at least go on record to make sure that we're not gonna be in the same situation or have the same problem when that time comes. So whatever we need to do between now and then,
Correct.
I just wanna make sure we have a process in place, we have all our ducks in a row, whatever needs to happen in the order it needs to happen. We're giving ourselves a 9-month runway, or I don't know exactly what the time frame is.
End of the year.
End of the year, so let's call it 9-ish months.
On it now.
I don't want Supervisor Gray here in December, again upset with us that, hey, look, what's going on here, I didn't know. It wouldn't be fair.
So, this has wandered.
Yeah, I'm done. It's my stuff.
We need a motion of some sort, but I'm understanding that if we postpone 30 days, that creates a tremendous amount of work for not a whole lot of anything, because the CVTs the rates are gonna be the rates. So a 30-day extension doesn't make a whole lot of sense, in my opinion. I think we either
couldn't phase in though, you're right. We can't phase in.
postpone to the board meeting next week and deal with this, have a finance committee before that, or we vote for it now.
I guess, I mean, might not pass.
I will take a motion and we can vote.
I'll make the motion to postpone. I know, again, that you've made, I understand where you're at, but I'd still make the motion to at
But
least.
postpone to when?
Pick a date.
Because,
April 30th.
I support it.
you mean the contracts or the whole item?
Contract April 30th.
No,
Yeah.
we'll have to extend the contract at the
But
current
he's saying
rate.
postpone, that's different than extending the contract.
Right, those are two different
Two different things.
Right, so
Yeah, so what do you want?
So I would extend the contracts until such time on April 30th, we can, by April 30th, make a decision on how to proceed with this.
I support that.
Okay, when you say make a decision on how to proceed, are we, I'm assuming the rates are not gonna change.
Right.
Right.
Dave said that.
The rates are not gonna change, so basically, we're just pushing those off for 2 months.
I'm talking about the amendment. But we could in that 30 days, maybe, I'm not sure, I think Dave said we couldn't. We are the policy makers. we could try to, I think this is our purview as Board of Commissioners, phase in or do something different in the contract in that 30 days. I think, isn't that our?
You would have to renegotiate, is that correct?
No, if you give us a directive, at this point, I need a percentage. That's all I need, and then
So
we'll
we
go back
could
and
do that in that
recalculate.
30
So
day, you know?
That's up to you.
Then that would be worth postponing, but to do all that work and we're not gonna do anything different is stupid. I mean, because it is they're gonna have to write all those contracts again. But if we have some kind of action we wanna take within that postponement of the 30-day contract, say we do wanna phase in and we work with them and negotiate a phase in, that's different if we postpone the 30 days, because then their whole contracts would change anyway. But just to postpone for 30 days to see our calculations or to see what, I don't know if that makes a lot of sense to me either. But if we're gonna try to fix something, Chairman Woodward, I don't know. If we were gonna try to phase in, but I think he said we couldn't, but could we phase in? I think it's up to us as Board of Commissioners on Finance to come up with something.
So.
Putting that out there.
What I was thinking is, I had consulted with fiscal to see if the consultant somehow could meet, even if it's virtual, I guess, for us to have like emergency meeting, get clarity on this process. And then on the 14th, we come in at 8. And finance come in at 8, caucuses start at 8:30, and then we deal with this type thing. Because it's the only thing that we need to pass. It's just this one item. And that's just what I'm thinking, if we need to stay within this before this March deadline date. That was the only, I just want to throw that option of what I thought of that. She could find out if that consultant could come, and hopefully I pray they can, and if we all decide that, we just gotta make the time to make, just to get this clarity and, go from there, cause we're the ones that ultimately gotta, move this.
So the motion on the table right now is to extend the contract for 30 days. Is that the motion that we have on the table?
It's really like 45.
April 30th.
Just so that it's a fixed date, April 30th.
But if we're not gonna do anything in that, it's a lot of work.
And I do just want to mention to Commissioner Powell's point, who had just mentioned that you could maybe have a special finance meeting. You could also, all of these items are motions to recommend the board approve. You could also just do a motion to forward to the full board. This item has already gone through one committee. This could be forwarded to the full board, and you as commissioners, obviously through the adoption of the agenda, can choose to include it or not based on the caucus meeting. So not necessarily a requirement for a special finance meeting, but if you wanted that opportunity to deliberate, it certainly is accessible.
Phased in, it would be.
I like that. I get it.
So if we had the original motion maker withdraw,
Yeah, I'll withdraw.
and if a new motion was made to forward without a recommendation.
I'd like to forward this without a recommendation to the full board.
Do I have a second?
I second that.
So.
I'm sorry, what was it?
We're forwarding it without a recommendation.
To the full
To the
board.
full
To the
board.
full board.
Oh, and then we're gonna have a meeting before.
Yep,
Yeah.
figure all that out, yep.
And get the consultant here, hopefully in advance of that meeting.
Yeah, before the 14th.
Cause you have a meeting on the 12th.
I don't know if that's gonna be caucus.
Yeah, but some of them can't make it, and right now, this consultant may have to even be
So
scheduled
can you
virtually.
repeat that current motion?
The motion would be to recommend to the full board, I'm sorry, to forward to the full board
Without
without a specific recommendation.
Okay, and we have a motion and a support.
Point of order, don't they have a motion on the floor?
He withdrew.
Okay.
I withdrew.
But yes.
Okay. With that motion, let's prompt the vote.
Yes.
Say it again, sorry.
Recommend for.
Okay,
without
and then we're
To the
going
full
to
board.
full board, okay.
Without a recommendation from finance.
Ooh, that's safe.
Commissioner Long, I think you'll need to do a voice vote.
Oh, yes.
Well, it's always the thing you think is easy.
We're taking no action?
Forwarding it.
We're actioning.
Forward it to the board.
Motion to forward.
Little smirk there, Wiper.
No, I'm just trying
Well, this
Yeah.
thing is,
One nay.
Oh.
One
but
nay.
can I,
Commissioner Powell.
but there is a request in additional since we forwarded. However, the request is that fiscal try their best to get the consultant to consult with us prior to the 14th board meeting. I don't know, I just wanna ask our colleagues here, especially for finance, make ourselves available.
Right.
when this can happen, please.
I wanna, yeah.
And I just told her, I don't care if it's virtual, we all need to just try to be on this cause, whatever she can kinda.
So it's 2 no's now,
I changed my own now.
but 3
And
to
then
2.
if the consultant can't, I think she'll let us know in enough time to where we'll, figure something out, but.
I don't know, Phil, cause I don't think I need to.
But
I'm
why?
gonna switch mine to.
So,
Do you
yeah.
mind just prompting the vote?
Yeah, just do it again, sorry.
Yeah, I'm not.
Okay. No to forwarding
And
to
sh-
forward.
I'm going to reset the vote and reprompt,
We're not deciding anything.
reset,
I know what I'm doing.
forward to full
Just
board.
vote for it. I think because I think we need to phase
I'm gonna
in.
Did you wanna hear the comment first?
I just have a question, so if I can get Maximus to put together a meeting, what kind of timeframe
That's what
needs
I'm
to
saying.
happen? Cause if there's a quorum, it needs to be posted, it needs to be an open meeting, right?
I think that we can work through the caucus meetings and through Chair Woodward to be able to schedule that.
Thanks.
I'd like to phase.
And if we need a special meeting to do so, we will.
Yeah, I don't know.
Just coordinate with staff and staff can do whatever posting is necessary.
And the meeting can be virtually and in person, possibly, okay, perfect.
Yeah, because we're not deciding
We're not deciding.
Nothing,
I
it's
don't know
just
how to
informative,
be
yeah,
deciding
just
anything in that
yes,
meeting. It would be
informative.
Right.
an informational
Yeah,
meeting.
Yes.
you just voted no now.
Well, I
Well,
haven't
he can
voted
still
yet,
say
but
it.
we're re-voting.
Maybe will you hit the thing again? I might
Commissioner Long,
still
you're
be
having
out.
an issue on yours, so
Yeah.
you'll be
Okay.
voice vote anyway, so everyone
Alright, I
just go
gotta
ahead
think
and
of
use
it, don't put me first, let someone else.
I already voted.
I mean, I guess it's,
I mean, you guys all voted yes?
Yeah, we voted all, yeah.
Okay.
I did-
Commissioner Hoffman?
We still have the issue, we still have the issue then,
right,
and I support we'll send it to the board.
Right.
now you switch your no to yes?
Yeah, cause I got thinking about it, but we still have the issue of if we phase this in or not.
Yeah, that's
We-
what my
we-
thing is.
We do set the policy here.
Right, what my
And we
point is.
direct, I mean, if we're saying we've been subsidizing this all along,
so.
and we
what's
wanna help the
another-
CVTs, then we
Phase
can
it.
phase it in. It just means we're subsidizing it if that's what we're doing it a little longer.
Another 6 months, 8 months.
Again, the way the process, and I don't wanna rehash that, was brought to us, we only heard about it from the CVTs.
Right.
Nobody brought it to us ahead of
I'll
time.
be yes.
So in order for us to get clarity on phasing
Nah,
in
send
the
it to the
process,
board, we're gonna.
Chairwoman.
I'll be,
Did we get a vote?
I'll be a
They're
yes.
still saving their votes on this side of the table.
I'll be yes.
Long.
Yeah, we're just not doing a recommendation at this time,
Right,
so we have
forward.
time to work. I'll be a yes.
You gotta
That's
hit
what
save.
my first instinct was.
Oh, okay, sorry. Yeah, no, I don't wanna rush.
Unanimous?
And
It's your vote.
Ramen.
But
So can you just clarify, this is to forward to the full board without recommendation?
Right,
That's
we're
all
gonna try to do something in a
Correct.
week or whatever,
Okay, you have 7 yeas, 0 nays.
but I think
Well,
we can phase it
so,
like he's
wait.
saying.
Okay,
Did you
the
call it
motion
now?
carries
Okay,
to
just take it to the board.
forward it to the board without a recommendation from the finance committee.
Correct.
Okay. Commissioner Powell?
So I was just gonna say, so if we're interested in this phasing in process, right? And we're supposed to have some teeth in that process. Who is to consult us about clarity so that we know if we want to add that into this process? Is that
Woodward.
Corp Council? Is that Dave?
Dave Woodward's off the screen.
No, just to
No,
clarify to
who
Commissioner
would- yeah.
Powell,
Yeah.
what Chair Woodward did discuss in this meeting and he submitted for your next finance committee meeting is a change of the county policy to require the rates come before the board before they're communicated out to
Yes, he did say
those
that.
communities. So Chair Woodward has already directed staff to take steps to put that into the county policy, and you'll be debating that and or deliberating that
Just talk
here at the
about this
finance
one
meeting.
now.
Now, for this one,
Yeah,
what
for
it'll
this
be
one.
is us as staff working with fiscal services to either schedule a special finance committee meeting or through the caucus meeting. So myself and fiscal services will work with the sheriff's department to be able to arrange that conversation for you prior to.
For
full
this
board.
phasing in
Yeah.
option?
Yes, that will be,
Yeah, why
and
can't,
Okay.
yep, you'll have the
Okay.
opportunity to
phase it in.
discuss that.
We can
Yeah, I
support
just, so that we can understand how that process goes. So that's, okay, great, you got
That
it.
was
That's all
good.
I was asking.
No, that's
just to see
good.
Who do we talk to in that process?
Yep.
So we know, okay, got it, you got it, okay,
Okay.
great. All right, so they got
That's
both.
what, if we get something done it like that, that would be worth and not have a record to me.
Okay, Commissioner Whitebird.
But that doesn't fix where we're at. I mean, the extension of 30 or 60 days could have given some of the CBT some time to look elsewhere maybe, but you know.
That's too fast.
That's, I know that's too fast. Sometimes they need a year to find
Yeah.
dispatch with that.
But don't we
and
amend
then-
contracts all the time?
And then
Yeah.
Gaya's wasn't a suggestion, but she said it could be our direction to what's gonna be
Right.
the cost,
And
right?
and that's what
The
we're trying
rate
to.
of this cost, so
Yeah.
that's a different thing than hearing from the consultants on, here's what we say it is, you know, the consultants say, here's what the indirect costs are, right? We get to set the rate on the indirect cost.
But the cost is a
Right.
cost, like Gwen said, the
Right,
cost is
but
gonna
we
come
can
back the same.
But also, just like she said with the phasing in process, if we decide that that's gonna happen, then that's gonna happen, and that's the conversation that
That's what
he's
we
gonna
decide.
set prior to us taking any votes on this before that board meeting. That's the goal, for us to have this conversation, correct? On that phasing in, because then if that's the case, yeah, her work will be a little cut out for, just to put that contractual change in there, but for the most part, at least we understand it, and that is an option that our CVTs, we're trying to help them.
Right.
True.
And I wanna make a point or ask
support
a
it.
question or put it out here for people to think about. When we say we're gonna phase in, let's say the 3-year cost is $3 million. Does that mean, the first year we're gonna change it up so they only have to do 500,000 the first year, and do we add that on to the last year? So the number is still what it's supposed to be across the 3 years?
I'd say no.
That's
Yeah,
kicking them.
but see,
That's a mortgage problem.
So yeah, so that's why we're trying to see what all our
Exactly.
options are.
So I want us to think about that
No, you're right.
because we're
That's right.
talking about, if we say, we're gonna let them phase it in, then the county's gonna absorb that cost. And I
We
have
have been
to.
for all- we already did for, since
Well, I
I've been
know we
here.
already did and we're trying to solve this problem. And I get it, that the, smaller CVTs.
It's a large percent of their
It's a
budget.
big number for them and I understand that.
I just want us
and
to
I get-
all.
But
To make
let's
it-
answer that question, right?
Right.
When we say phasing in,
Right.
does that mean only part of?
Forgetting some of it or forgiving or.
I'd have a hard time saying yes to that, so.
And not to even say we'll go with it, I just want us to understand that process and be clear on that option, that's all.
Right.
That's all, it's all communication right now and informative. All right, thanks
All right,
everyone.
so we passed that one, 7C, just wishing unanimous to.
Sorry, you guys.
I see Curtis over there his eyes are in the back of his head by now.
It's not one person's job.
Under Sheriff Childs, I should call you by your title. Okay, next up, item 8, departmental recommendations. First is 8A, purchase of countywide digital asset management application from Media Valet.
to stay here so long.
I'll move it.
Moved by Commissioner Smith Charles,
Yeah, hurry up,
supported
move
by Commissioner Whiteford. 30 minutes. Okay,
We should be good. We should be good after these now.
thank you, Mr. Gray. Okay, yeah, because it was all up there
Ganging up on us.
saying.
Safety of members.
Yeah, that's true.
Okey dokey.
Came back and told us that was good.
Let's do this one.
That was
Good
good.
morning, I'm Teresa Rosento, the Director of Public Communications, and I'll let my colleagues introduce themselves.
Hello, I'm Caitlin Keeler, Marketing Communications Officer in the Public Communications Department.
I am Tammy Shepherd, IT BRM.
Davenport IT.
So thank you for hearing our request today for the budget amendment that will allow for the purchase of the new digital asset management tool. This predates me, but you'll recall back in August when we came before the board, this tool was on the list for key initiatives in fiscal year '24. This digital asset management tool will give us the opportunity to better manage our graphics, our images, documents, and videos with more efficiency. And while it will be primarily used by DPC, any department and elected officials' offices will be able to utilize the tool. We plan to replace our current system for several years, and now it's end of life. And we've completed the bid process, so we're ready to execute a contract upon your approval. So we appreciate the consideration.
Okay, anybody have any questions?
That's one good thing, we're questioned out.
Right, I'm over it.
Questioned out for all the rest of you. Our brains are not.
I am not seeing any questions, so let's prompt the
I
vote.
should get out of that. I feel bad for Oakland Center staying here so long.
Well, she's learned all about how
Yeah.
county government operates
Yeah.
today.
More than you ever wanted to learn.
Oh, Hoffman, you busy today.
Yeah, Hoffman,
Yes.
It's getting springtime.
He's worse than a teenager. I'm out.
Oh,
Yeah.
Yes.
You know, I think when I switch back to see if
Robin?
anybody's asking
Robin?
questions.
It's not loading it up,
Okay.
yes, I'll
It
put up a
does.
yes.
Then you don't get your vote.
we have 7 yeas, 0 nays.
Once again, with the IP awards.
All right, thank you.
Thank you.
Thanks for
Thank you,
sitting here.
sorry you had to wait that long.
That was pretty anticlimactic. Okay, I probably should have moved Baldwin Center.
31,000 digitalized.
Next
Yes.
up, we have
Yeah.
item 8B, the fiscal year 2024 first quarter financial forecast.
I'll move it.
Commissioner Smith-Charles, supported by Commissioner Powell.
good afternoon. Good afternoon. Cheryl Johnson, the interim deputy CFO. I am joined with my chief of grants and budget, Kimberly Coy, and sitting in the wings as a support is our new CFO, Brian Leffler. I'm gonna let Kimberly present the item, and then I'll be here to support any questions you guys have. But I did recall hearing you say you were questioned out, so.
Yeah, maybe
Not
not.
for you.
All right.
She was helpful.
Good morning, everyone.
Sure.
It's good to see you again for the quarterly forecast report. I did just want to make a quick note. We did identify a few minor corrections in one of our amendments today. So those are going to be updated in the packet on document page 2 and 15. So did want to let you know that. But first and foremost, I do want to give a brief recap of the content that's included in the forecast for anyone in the public who hasn't seen it before or anyone here who hasn't. So we start off first with our transmittal letter. So this is our narrative overview of the general fund. Then after that, we have our Schedule A budget amendments, which is our general fund budget amendments. After that, it's followed by our Schedule B amendments, which contains our proprietary, special revenue, and restricted fund amendments. Then we move on to our forecast reports. So first, we have our individual general fund department summaries. These are gonna be your one-page snapshots of our department activity. Then after that, we have our proprietary fund forecasts. And then we follow that up with our donations and our write-offs. So there is quite a bit of detail in here, but we are going to focus on the highlights and then allow you to ask questions at the end. So I typically like to utilize the department summary in conjunction with the transmittal letter, and you will find that on document page 15. You know, we always like to provide, oh, I'm sorry, document page 18. I said 15 and the number was in my mind. But we do enjoy doing this because it allows us to provide you with an update on how our revenues and expenditures are tracking in the public. So we are going to start out with our revenue forecast. So right now, nothing too significant. Our general fund revenues are forecasted to be $3.6 million lower than the revenue amounts included in the amended budget. So this is going to be your net result. It's primarily made up of our $3.7 million shortfall in charges for services. So this is concentrated mostly in the district court, and it's the result of lower fees and fines. And it's, you know, based on caseload as well, where they've seen a reduction, and there have been some state policy changes that have impacted that as well. So this is just going to be, you know, one of our items to monitor as we go throughout the year, and it's something we're going to take into consideration as we work on our preliminary revenue estimates. So in addition to that, we have a few other small variances. We have some lower forecasted other intergovernmental revenues. It's a small amount, $139,000, and then approximately $305,000 in higher revenues across a number of other smaller revenue categories. So this is primarily our general fund revenue highlight. We're going to move on to our expenditure summary. So here we have our total general fund expenditures. They're forecast to be $25.8 million lower than the expenditure amounts that we have in our amended budget. So this is going to be our net result of our lower forecasted expenditures in the departments. They are spread out across our personnel and our operating budgets. With personnel, you have your vacancies and your turnover factor and lower activity and operating. There's also detail in the individual departments if you want to check that out. One thing that we do need to mention, and this is going to be another item to monitor, is we are seeing a forecast within the Sheriff's Office over budget by $3.6 million in personnel. So we have touched on this before. It is primarily due to overtime costs. There are some factors. There is the holiday overtime. There is parental leave, overtime spent for officers to go to training, hospital watch. So essentially, it is a trend that we are going to continue to monitor. We have been working with the Sheriff's Office and watching these metrics closely. It is something that, per the General Appropriations Act, will need to be adjusted at year end. So it is just a reminder to keep in mind. And then obviously we are going to be assessing these areas during budget development and continue to work with the Sheriff's Office to come up with the appropriate level. Excuse me. Okay. So now I'm going to move on to the impact on plan use. So in our amended budget, we have $27.5 million budgeted in plan use. Just a breakdown of that, we have $7.7 million. It's for your road programs and for other one-time purposes that were included in the adopted budget. And then we also have $19.8 million for our carry forwards and our encumbrances. Those were included in the year-end report. And those are funded from unexpended allocations in the 23 budget. So in total, we do anticipate that the net impact on planned use is going to be $5.3 million less than the levels assumed in the amended budget. And that is at the bottom of the department summary in document page 18. And we do just want to remind you that it's first quarter, it's still early on, so there's obviously going to be more activity ahead of us, but we will always keep you apprised in our quarterly forecast updates as the year progresses.
Okay, good questions? Commissioner Rauman.
Thank you, Madam Chair. I guess I just wanted to quickly address, I touched upon this previously in the conversation too. So it looks like just the one department is Sheriff's Office that's currently slightly over budget, $4.5 million. If I'm reading this correctly, the personnel costs exceeded budget by 4.5.
Yes.
But overall, they're excess by 3.6. So they absorbed like 900,000 somewhere else within their department.
Yes.
Is that what I'm understanding?
Yes.
So I guess what happens to keep track, and I appreciate the explanation too that we're gonna keep tabs on this, but as a department, whether it's Sheriff's Office or anybody else, if they have a set budget and then they spend and go over budget, is there a checks and balances generally for that? I mean, are they asked to sort of, figure out a way to get back within budget from there, or?
Well, I think with the Sheriff's Office, it's a little different because we do provide service to other communities and we provide a 24-hour service with the Sheriff's Department. I think with that, what we're gonna be focusing on this year is making sure that next year our budget is more appropriate for the levels that they're working. I think that we have not taken all of the things into account. During COVID, we had a lot of vacancies in the Sheriff's Department. We've made some benefit changes and, COVID is primarily behind us and we're able to hire more staff. And so when they brought in, and I'm not sure, I know they hired a whole bunch of people. And so when they do that, then they have training, and the training happens on overtime. So we're still kind of out of whack on the budget piece. So as we monitor that, our plan, and we've been working with Gaia and her budget analyst, Terry, and we're gonna make sure that we have a plan that accounts for those overtime things and make sure that we've got a solid budget going forward. Because it feels like it's been, because of COVID and because of the 24 operations and how much overtime they do have, it has not been able to get right-sized. So that's our plan, to right-size the budget piece of that as opposed to the staffing side. Now, if it was a staff like fiscal, so we staff for full employment. So we assume that everyone is, on every position that we have, that you all have approved is filled. And then we put in departmental a credit for those vacancies. And so we've been using some of that to cover for the sheriff's department because the issue is truly in their overtime and not necessarily in their staffing because we budget for full-time. So, if it's a different department and they're having problems with overtime, then we might ask them, what's going on? Do you have a special project? Do you have something that we need to figure out where we're gonna get these funds from to cover the overtime? Because typically, obviously for work-life balance, we don't want employees working a whole bunch of overtime. We wanna make sure that we're staffing at appropriate levels. But the sheriff's office is a little different because it's 24-hour and we do provide the service to other communities.
So is it safe to assume that, I know this is just Q1, but Q2, Q3, we probably see the same trend just because
Yes.
the need doesn't change.
Yes, and we did end the fiscal year last year with a significant overage in the overtime budget. But once, if you think of the process, so we adopted the budget, June, July, August, and then when we start looking at the year end and we see that we're over, so there's a little bit of overlap, so it takes us a couple of months and cycles to get caught up.
Thank you.
Commissioner Whitehead.
And it's just a forecast, the
Absolutely.
sheriff's department hasn't done anything wrong.
No.
It is just the fact of COVID and then the fact that Sheriff Bouchard's here all the time, people are not going into being deputies. They couldn't get personnel, then COVID. And so overtime can be controlled a little bit, but not if you don't have deputies.
Right.
And you need them. A hospital watch, you can't control that. That one's unpredictable. And then a lot of the contracts went through, which we're not gonna argue that everybody had the right to, if they went to arbitration and those contracts. So it wasn't forecasted perfectly, and that's why you gotta monitor it. So
Absolutely.
this has come up as an anomaly, and we'll just plan for it.
And that is another piece that I kind of forgot about was the contracts, because the sheriff deputies do have the ability to go to arbitration because they can't strike. So then we were sort of left at the mercy of what the arbitrator determined the rates should be for the command. And so we were a couple years behind in those contracts as well.
Right, so and we're gonna plan for it, monitor. Yeah. Okay, thank you.
Okay, anybody else?
Oh, yes.
Commissioner Smith Charles.
I was just following up on that one.
Because
I'm sorry if I
here
cut-
twice. Yeah, I was gonna ask about SSI with the sheriff's department, but it sounds like based on the questions you guys asked, you're gonna monitor that. My question is more so for this committee, kind of in line with what Commissioner Rahman said a little bit ago, but just something I've been feeling for years when we do these budget hearings. It's like we arrive, the departments get like 20 minutes to really quickly throw a whole bunch of stuff at us, and then they leave, and then another department comes on. It's, how that goes for 2 weeks, and then we show up at full board. We're like, yeah, we're voting this thing in. So my ask is, the executive seems to ask these departments every year to make cuts. I don't know if that's a proper term, if that's politically correct, but it basically boils down to cuts. And, these departments come and they report to us at finance throughout the year. And I just feel like I don't know if it's a debrief that needs to happen before the hearings start. And the reason I'm bringing this up is because of, this being a financial forecast. I just feel like sometimes the target is moved on us. We got a forecast, we've got, amendments and appropriations and things, and then we ask these folks to come and tell us how they're gonna find 5% of a cut in their budget. And then we still want them to maintain services. And then they come back a few months later like, oh, by the way, we need more money. And it's just like, I feel like there's a better way. And so I don't know if Gwen, Madam Chair, if you meet with the executive on a regular cadence in terms of like a unified vision for what we do around here, but I'm just tired of ask for money, they tell them to cut, and then they come back and they're like, we need an adjustment in the budget, and then they ask for more money, and then we cut, and then it's just like this dance. It's silly. I just really think like if we could get something before the budget hearings, I know, I don't want to see you all another day either, but it's just something there where I just feel like it's a hurry up to just get through it, and then we really don't have any, it just feels like a process to just pretend like we're doing something. And so if there was a way that we could hear from the executive, hear what that vision is as to why we're asking these people to remove staff or reduce or whatever. So that way when they come during the budget hearings, I just feel like we'll be a little bit better prepared as opposed to reactive. And I'll leave it at that.
So I think because the executive does come and present the budget to us before we start the hearing process. But what I think you're asking these folks to take back is, can we have like a pre-step to that? Which is, what are the highlights that are driving the philosophy of the executive with the budget they're presenting to us? So that we're seeing it before and it's not just coming out in the budget hearings.
Yeah, it feels like we have an ex-husband who lives on that side of Telegraph, and he says, this is what we need to do, and then the kids come, no offense, and they're like, but we need more this. And we're caught between a rock and a hard place because we want to satisfy both parties.
That's a good point. Yep. So maybe a little more communication before the budget itself gets tossed over the wall at the meeting at the end of July, that we have a little pre-discussions about what are the high points, what are the changes, what's the executive telling the departments that we are not necessarily hearing until the budget appears. So that's a good point. Thank you. Anybody else? Okay. Seeing no other questions or comments, let's prompt the vote on item 8B. We're almost done. The most important one is at the end, so.
Yeah.
I'm not gonna go. No kidding. Thanks, Sheriff.
I'll just call it.
Yeah, because I did come up either.
Long,
Yes.
Hoffman,
Yes.
Thank you.
Laker,
Yes.
Barkham,
Yes.
Powell,
Oh, yes. And I think.
Smith Charles,
Yes.
Rahman.
Yes.
You have 7 yeas, 0 nays.
Okay, motion carries.
Thank you. Thank you, Cheryl, on the Sheriff's Department item. I appreciate your help.
Thank
We
you.
all,
You guys
we
have a
all
good
do.
day.
She was good answering a lot of that sheriff, that dispatch stuff,
We
yes.
need to go now.
Yeah.
Okay, item 8C, for which this
Who wants to move
young
that
lady's been waiting the whole
Oh, yes.
Sponsorship of the Baldwin Center Closed Closet Renovation
Supported.
Project, moved by Commissioner Powell, supported
Take my
by
clothes there,
Commissioner.
my tags on.
Oh, good. I'm happy
I've
you do.
taken stuff there
I
myself.
do. I like
Okay.
it. I love that.
Yeah, come to the end of the
I feel
table
good
and
giving
just
stuff, 'cause
tell
I have
us
tags on stuff too.
Sorry, you had to wait so long.
about your project, and I do
It's okay.
apologize, we probably.
I'm exhausted for you all, that was.
Yeah. It does,
Yeah.
you get tired mentally.
Well, first of all, my name is Heather Duenas. I'm the Deputy Director at the Baldwin Center. All of the proposals and the information had been submitted by our Executive Director, and she was unable to attend. The conversation actually first started between myself and Councilman Goodman, who's a friend of mine. He's our council district person, but I also live in the district. And he said there might be a possibility for some help, and that's how I connected those two, our executive director and Councilman Goodman, and that's how we're here today. I know Commissioner Powell for many years. I was a Powell volunteer, and she used to come to dance with Coach Taylor, and so I've lived in Pontiac for many, many years, and I actually student taught right in our district as well. So I am equipped, to come and answer the questions. There may be questions that I will have to apologize, but I'd have to refer to our executive director for. But for the most part, I run the day-to-day operations at Baldwin. Monday through Saturday, I'm here every day. I live very, very close. So I do ask that you support us for our closed closet renovation project. I know that there are a few questions, and I'm ready for anything that you have for us. I don't know.
This has come to us as a special project request by Commissioner Powell.
Yes.
Can I say something?
Yes, ma'am.
Okay, so just to give my colleagues background, Councilman Goodman brought it to my attention. I have not patronized the location, but everybody knows Gwen Markham is born and raised from Pontiac, right? And so I brought it to Gwen, like, Gwen, do you know about this place? And she's like, yeah, I've made donations, this, third, the other. And she spoke so highly of them, I'm like, okay. So this is something that we need to pursue. So when Gwen gave me the cue to, now we co-chairing this though, I just wanted to support it. I do know that they do a lot of work in our community and just throughout Oakland County. So thank you for that. And then I just found out 2 seconds ago that another commissioner, Long, patronizes you all. So I just think it's a great organization. They do great work in our community. And if we can help them keep that building together or contribute to their building renovations, that is a goal that I think is great for our community. So thank you, and I just hope my colleagues support it.
Thank you, Commissioner. Anybody have any questions or comments?
I have one more question.
Commissioner Powell.
Be it that, are y'all still trying to seek other donations to help with this, or are y'all close to the goal of getting the amount that you all are needing?
So we did have a couple of emergencies arise on other aspects, our freezers going out, our walk-in coolers were, having some issues. So we are looking for fundraising on those aspects. We've actually looked into our reserves. We do have a very large cash reserves. So we try not to cut into them, but they are there, and that is what we have prepared to commit for the rest of the monetary.
Yep, so we just always want to make sure when we support from commissioner projects that you all have explored, making sure you're going to execute the project before we distribute the funds. So thank you very much for that.
And we have a gala in May.
Oh, perfect. Well, share the information with us so we can try to support. Thank you. Okay, I have nothing else.
Anybody else?
And I brought paper copies if anybody wants to see them, or pen, and as well as our services that we offer other than our clothes closet.
Oh, cool, thank you.
Excellent. Okay, seeing no other comments, please prompt the vote, which already beat me to it.
Yeah.
Thank you.
Yeah, she wants to.
I logged out.
Okay, you sure did?
She wants to get out of here, right?
7 yeas, 0 nays.
After that last comment, we gotta talk about budget hearings, so she can't go anywhere.
Oh.
Okay.
Thank you, sorry you had to wait all
Motion
day,
carries.
but
Thank you so much.
it passed, everyone voted for it, so it was worth waiting.
When the commissioners came?
All right, last item on our agenda is public comment for a second time. Is there anybody here who wishes to address the committee?
No.
Seeing no one, I'll
I'd like
close
one, yeah.
public comment.
Oh,
And
thank you very much.
is there any other business? Seeing none, I will call this meeting adjourned at 1 o'clock.
I'd like one too.
Yeah.